So now you have your patient, you have taken your patient to the emergency room, and now you have a gaping wound which you have to tie. You need to know your suture techniques so that you can tie that wound. In this section, we are going to talk about the suture techniques themselves. We'll see what the various types of sutures are, what are their uses, and how they are actually done. So, starting off, there are 4 basic types of suture techniques. These include the interrupted sutures, the continuous sutures, the mattress sutures, and the subcuticular sutures. So, before getting into the detail of them, I'll just give a brief overview. The interrupted suture, as the name implies, are interrupted. These are the individual sutures which are performed at a 90-degree angle to the body. Then between the 2 planes, there's again 90-degree. And then at a 90-degree angle, they exit from the body. Now, in continuous sutures, the initial first suture is like the interrupted sutures, but the next of the sutures would be continuous. They won't be interrupted from one another. Again, they would be at 90 degree. They would follow the line of the wound, but they would be tied together. In this suture, the assistant of the surgeon follows the suture line and provides tension to the suture, but keep that in mind, you do not have to present a lot of tension in this suture. Now, mattress sutures are of 2 types, the vertical and the horizontal mattress. You initially throw in an interrupted suture, then either with the help of a vertical or a horizontal mattress, you bring the 2 sides of the wound together. The subcuticular sutures are used below the cuticle. Their involvement cosmesis is very important. They can be used with absorbable or non-absorbable sutures. In non-absorbable sutures, the knot is a deep buried knot so that minimal scarring might occur. So starting off with the interrupted suture. So as it can be seen in the figure, these are the interrupted sutures. These sutures are actually thrown one by one. These are interrupted. They are not linked to one another. Now you start the suture at a 90-degree angle. Then you go through the tissue. You maintain your 90-degree angle. Then you pass through the 2 planes of the sutures. And that is the 2 sides of the sutures, again maintaining the 90-degree angle, and exit at a 90-degree angle again. So it forms a 90-degree angle altogether. These sutures are helpful in closing the skin wounds, the gaping skin wounds. If a wound is very large, it is usually advised to throw an interrupted suture in the middle and then close the wound from the 2 sides themselves. So let's see the details of these sutures. They require the insertion at a 90-degree. We have already talked about it. You pass through both the aspects of the suture line. So you pass through the right aspect, the left aspect. We've talked about it before as well. Now, a 90-degree angle is the prerequisite of an interrupted suture. You have to pass through your entire suture line, and now while passing through, you have to maintain your angle. Now, the needle rotation, it goes through the tissues. Obviously, you have inserted the suture with the help of your with the help of your needle, and the rotation of that needle would follow the angle with which you'll close the wound. Now, the distance from the entry point of the needle to the wound edge is equal to the depth of the tissue. This is what usually happens, that the needle point, it covers the depth of the tissue. You should always cover the entirety of the wound depth because it is important so that you can close the wound completely. Now, the distance between 2 successive sutures should be twice the distance between them. This is important because having twice the distance between 2 sutures helps the body to heal itself appropriately. Now, we've talked about it. It is at 90-degree angle. Now, in a linear wound, again, you first place a central interrupted suture and then close it from both the sides. Now, starting off with continuous sutures. So, continuous sutures, here you can see, first of all, you throw an interrupted suture. Then the next sutures are continuous, they're non-interrupted. Now the continuous sutures, again, they follow the 90-degree rule. You are at a 90-degree angle from the suture line. You maintain a 90-degree angle. However, you do not interrupt your suture in this condition. You do not cut your suture, but you keep on going on with that thread. Now, your assistant has to follow the thread line and has to provide tension so that you can suture properly. Now, the first suture is interrupted. We've talked about it. Other sutures are inserted in a continuous manner, as can be seen in the figure. Each suture should be at 90 degree. We've talked about it. Now, while your assistant is following the suture line, he's to keep in mind not to produce too much tension using the little suture length. Now, the post-operative edema might follow if you apply too much tension or use too little suture length. Post-operative edema might occur. It usually occurs in these. And this type of continuous suture is tied down by an Aberdeen knot. An Aberdeen knot is a specific type of knot that helps to hold this continuous suture. You should learn the Aberdeen knot by various tutorials available online. So now moving on to the mattress sutures. We've talked about it. There are two types of sutures, the vertical mattress and the horizontal mattress. The vertical mattress is responsible for eversion of the wound. The horizontal mattress is responsible for inversion of the wound. They help to bring together the two opposing sides. Now this is the vertical mattress. Here you can see this is the horizontal mattress. So it can be either a vertical or a horizontal mattress. The vertical mattress produces eversion and the horizontal the inversion. Now the initial suture is inserted as an interrupted suture. Here you can see. Now the needle moves either horizontally or vertically, whatever the case might be. Now it produces approximation of the tissues that are being involved. Because it is a continuous type of suture, it is a mattress that involves two layers, so it provides correct approximation of the wound edges involved. Subcuticular tissue, I've talked about it before. Subcuticular tissue is a response. Subcuticular suture is involved in the conditions where cosmesis is very important. It can be done with an absorbable or a non-absorbable suture. So here you can see subcuticular suture is a continuous type of suture, involves the skin, the subcuticular layer of the skin. So it is used in skin where cosmesis is important. We've talked about it. It can be used with absorbable or non-absorbable material. So what type of absorbable material? Non-absorbable material first. So non-absorbable material can be either collar bead or it can be tied closely. Now the absorbable suture is tied with the help of a buried knot. So buried knot does not leave wrinkles and the cosmetic appearance is very nice. There's no cross-hatched marking as in typical interrupted sutures, and there's very nice healing. Now let's talk of the needles which are being used for the purpose of suturing. So this is how we divide a needle. This is the 1/4 circle. This is the 3/4. This is the 1/2 circle. This is the 5th part of an 8th circle. This is a J-shaped needle. This is a straight needle. This is a compound curve needle. Again, a J-shaped needle. This curve and this J-shaped needle are different needles. All these needles are being used for different purposes in different parts of the body depending upon your anatomy. So needles are now eyeless and atraumatic. Initially the needles used to have an eye like a sewing needle and you had to tie your suture to that needle. But now they have removed the eye. That is because it was extensively time consuming and eye of the needle also produced charring of the tissue. Now this has been removed. Now the needle is usually grasped by the 1/3, the junction between the initial 1/3 and the proximal 2/3 and the distal 1/3. So this is where you grasp your needle with the help of a needle holder. Now, the nearer to the tip of the needle you are, you'll be having more. You'll secure your area more closely. However, the rotation of your hand would be limited. Further from the tip you are, the rotation of your hand would be greater, but the control of the needle would be lesser. So you have to compromise between the two. Now, closer to the needle tip, closer the needle holder to the needle tip, there is better control of the needle. Now, the needle has three parts. It has a shank, a body, and a point. So, shank is where the thread is attached. Then there's body of the needle, and finally the point, the pointed end of the needle. So again, these are some of the needles and the uses for these needles. Now, straight needles, curved needles, these are the cutting needles. Now again, a straight needle. Now this is a curved needle. This needle is used for suturing the bowel. The threads are swagged into these needles. Now, needles used for suturing the abdominal wall are again, they're round and curved. And these are used for cutting the aponeurosis. Now, the choice of needle depends upon the type of surgery you are performing, obviously the type of tissue that is involved. Whatever the type of tissue, whatever the type of needle being used, that depends upon your type of tissue and the type of surgery being performed. Now, what are the uses of various types of needles? So, if you have a handheld straight needle, where would you use that? You'll use it on skin. Now, a half circle needle, where would you use that? A half circle needle is used in GI tract. Now, a J-shaped needle. Now, a J-shaped needle is used in vagina. Now, a quarter circle needle is used in the eyes. And a compound curvature needle is used for the oral cavity. You need not to memorize this. You'll get to know the use of the needles by using them again and again. You'll understand what type of needle is used in what type of surgery, but this is an overview of the usage of various types of needles. So starting off, moving on with the types of needles. These were the shapes of the needles. Now we are talking of the types of needles. So needles can be round. Here you can see this is a round needle. Now the round needles, they gradually point to a tapered end here. This is the pointed end of a round needle. So they gradually taper off and form a point in the end. They are used to separate the tissue fibers. Now we can have a triangular needle. Here you can see this is the triangular needle. It has three cutting edges. So cutting edges along all the three surfaces. And then we can have a blunt edged needle. Here you can see this is a blunt edged needle, not a sharp pointed needle. So it is used in situations such as closure of the abdominal wall where you do not want a lot of muscle charring. So you'll use a blunt edged needle. So knotting techniques. Before getting into knotting techniques, it is important that knotting techniques are techniques that are required by practice. You cannot actually memorize them or learn them or cramify them. These are the techniques you have to perform. So we'll talk about these techniques now, but you'll have to perform these techniques by yourself so that you can know them. These are some of the techniques. A half hitch knot. Here you can see the half hitch knot. Again, a cross half hitch knot. Now again, these are the techniques you have to perform by yourself. So me explaining these techniques would not be helpful to you. So what you have to do, you have to take two pieces of thread and try to tie these knots. Once you try to tie these knots, you'll get a better idea of what these knots actually are. Moving on, this is the reef or square knot, the standard knot usually used. This is the granny's knot. Now this is extra half hitch or the reef knot on the reef knot. And this is the surgeon's knot. Here note the various curls, extra curls given in a surgeon's knot to secure the knot. So what are the principles of knotting techniques? So a knot should be firm. it should always be firm. That is the first and foremost principle. It should not unwind. It is the second principle. A knot should be such that it should not open itself. It should not unwind or slip. Then a knot should be tightened without tension on the strings. So it should be tightened properly and without the tension on the strings. There should be no sawing of the suture. So the suture material being used, it should not be sawed, otherwise the strength of the knot would decrease. Now the suture must be laid square during the tying. So why is that? Now when you're tying the knot, the suture should be in such a position that it might give optimal strength. So this is the reason for that. Now the knot should be as small as possible, because it is a site where foreign bacteria can accumulate, and as a result of which this knot can be problematic for you. So you make a knot as small as possible, and you make sure this knot is aseptic and not containing any bacteria. So moving on, what are the other principles that you need to keep in mind? While grasping the thread at free end, while tying, you should always grasp it at the free end, not the tying end. Now the standard surgical knot, here you can see this is the standard surgical knot, is the reef knot. So, okay, there are two things you need to keep in mind. Now, when a surgeon is making a standard knot, this is the reef or the square knot. This is what he uses. When the surgeon requires strength, say vascular anastomosis is going on. In a vascular anastomosis, the surgeon will need to have extra strength. And when the surgeon needs extra strength, the surgeon will tie a surgeon's knot. So this is the importance of a surgeon's knot. Now the granny knot, here you can see this is the granny knot, involves two throws of the same type and is a slip knot, that is it can slip on itself. So that's important in mind. Now surgeon's knot is using a two-throw technique to avoid slippage. So surgeon's knot is where you required a solid anastomosis and no leaking. So you use a surgeon's knot. Finally, there's an Aberdeen knot not shown in the figure. Aberdeen knot is used in the continuous sutures. That is what you learn by yourself. Aberdeen knot is a simple knot, but you have to try it so you can understand it. Moving on. Now, how much suture length should be left after you have tied the knot? So before cutting, you should leave at least 1 to 2 millimeter of the suture length. That is important, because if you leave less than that, the suture, the knot might unwind itself or slip upon itself. So this was all about this section. In this section, we learned a lot about knots and the types and where they are used. For practical purposes, you need to understand these knots, and to understand the knots, you need to practice them. Practice them and learn them, and you'll get better at them with time. For further such sections, keep watching sqadia.com.